Good morning. Welcome and thank you for joining us for week 6 of our Northern Light Health Business to Business Zoom conference. Today's topics are plan for what to do if an employee or customer gets sick, virtual team building, and the latest on COVID-19. I'm Dr. Ed Gilkey, the Senior Physician Executive for Northern Light Beacon Health. I'll be your moderator for the next hour. As you're probably aware, the U.S. continues to see a significant increase in people testing positive for COVID-19. As of July 13th, the case rate for 100,000 people, per 100,000 people, in Maine was 263, with Vermont at 208, New Hampshire at 445, Massachusetts at 1,619, and New York at 2,065, with Hawaii at 86 to give perspective. Maine is the 6th lowest state, and you can see those numbers on the slide there. As summer tourism season heats up, our numbers are relatively low, but Maine's vulnerability is high. I'm sure we can all attest to the number of out-of-state plates we see daily, and even some cruise ships making their way into our harbors. Keeping our collective doors open for business is partially dependent on us keeping our employees healthy and safe. Northern Light Health is here to offer up our guidance as employee safety is one of our top priorities. Today we will answer, how can we help you continue to safely keep your doors open? For those of you new to our weekly Zoom conference, Northern Light Health has more than 12,000 employees across our 10 hospitals and 125 locations, including administrative and financial offices, retail pharmacies, food services, walk-in care services, and bedside care areas. We welcome the thousands of patients, visitors, and customers each day through our doors. Certainly, we are all living in these uncertain times with increased safety requirements. In this series, we offer our experience in all these different settings to help guide you in your business. Before we get started, I will read our legal disclosure. Coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. In regard to employment, every situation is unique and must be reviewed on a case-by-case basis to ensure compliance with the law. The information presented should not be taken as legal advice, and you will need to retain your own counsel to review specific questions regarding employment situations and/or accommodations in your organization. This hour is for you. I invite you to make it a two-way conversation. Please use the chat function to ask questions. You can do this anytime. I'll keep track of them and have our experts respond. Also, to help us get a little more detail on how we can best support your efforts, we are going to email a 5-question survey following our Zoom conference. I encourage you to take a moment and let us know if this information is helpful and what topics you would be interested in us focusing on in the future. So let's get started. Our panelists today are Jennifer Hutchins, Director of Human Resources at Northern Light Mercy Hospital in Portland. The old saying tells us we must plan for the worst and hope for the best. The dynamics of COVID-19 on our workforce demands we all have a plan in place should an employee or customer become positive with the virus. Jennifer, with her more than 14 years of experience in HR, is based in Southern Maine, which we all know has the most people infected in our state, with a case rate of 644 to compare to the numbers I shared before. She will help us consider what's needed to build an effective plan. Angela Felicia is a licensed clinical social worker and is the manager of Healthy Life Resource Program at Northern Light Acadia. She joins us today to give us tips on how to keep our teams strong and working together, even if they're remote. It can be done, it just takes a new mindset. And Dr. Jim Jarvis will give us an update on the virus, its history, and what we know now. He will also provide the latest on testing and facial coverings. We'll start off with Jennifer. There are so many variables to consider when prioritizing the safety of our employees and customers. Where do we begin to make a plan, Jen?
Great, thank you. In order to start our plan, what we really want to do is ensure we are limiting the risk of exposure, which will hopefully limit the impact should someone, an employee or customer, ultimately test positive. The first step in that is universal masking, ensuring that both employees and customers are asked to wear a mask and are educated on wearing masks appropriately to ensure that both the mouth and nose are covered when wearing that mask. Depending on the nature of your business, you may also want to consider eye protection. For example, in healthcare here, we utilize eye protection for our employees who are in direct patient contact. Sanitize, sanitize, sanitize. Hand sanitizer should be available for employees, customers, and clients when they enter the building and in other areas so that it's readily available for them to utilize. Sanitizing high-touch surfaces on a regular basis, public spaces, registers, door handles, countertops, credit card machines, anything of that nature where it's getting frequent use. Physical distancing. Physical distancing does include a number of different components. To the best of our ability, we want to make sure that we're limiting the number of both employees and customers in an area at any given time to provide the ability to maintain that 6-foot distance from each other. Plexiglass barriers in places that can help, registers, opportunities where there may be that closer interaction or exchange of paperwork and things like that. Meal breaks. Meal breaks are one of those opportunities for high-risk exposure, simply by the fact that we're not masked during our meal breaks. In order to help mitigate some of that risk, we really need to make sure that we're maintaining that physical distance for our staff during meal break times. So as you look at your break room spaces, identify how many people could appropriately be in that space at any given time, which may mean you need to stagger breaks a little bit more than we normally would to allow for that limited occupancy of those spaces. The other component you may want to consider is cohorting your staff or grouping them together as you look at your schedule so that if someone ends up testing positive, it may be a smaller group of colleagues that impacts versus a more open schedule where a number of people are working with each other on any given day. And then, of course, symptom screening. So we really want to encourage employees not to report to work when they're feeling ill. It's really important to acknowledge right now that a simple headache or a sore throat are not simple at all anymore. They could be the onset of COVID, and it's best to err on the side of caution right now and ask them to reach out to their primary care provider or a local testing site to determine whether or not testing is appropriate for them given their current symptoms. So when we do receive confirmation that we've had an employee or customer test positive, it's important for us to answer certain questions to determine the scope of the exposure. The first thing we ask is of the positive patient is when the onset of symptoms happened. So when did they first develop symptoms? And from that time frame, we do a 48-hour look back here. So in that 48 hours prior to the onset of symptoms, we ask who were they in contact with? What employees were they in contact with? Were there patients, clients, customers that they were in contact with, and for how long were they in contact with those individuals. Was it prolonged, longer than 15 minutes? Were they in close proximity, or were they able to maintain that physical distance during that interaction? And then, of course, what protective equipment were they wearing, or what barriers were in place? So were both parties wearing masks? Was there a plexiglass barrier in place? So those are important questions for us to ask as we consider what the scope of the exposure was. Then we utilize the information that we've gathered in order to determine whether staff need to be quarantined or if we'll ask them to self-monitor for any onset of symptoms. Of course, our positive patients are going to be out of work and quarantining until they're recovered. And that length of time may vary for each individual depending on what their symptoms are and how quickly or that they take to recover. For those exposed employees who have not tested positive, or perhaps they have not had any onset of symptoms yet, we would determine whether they need to self-monitor. So self-monitor if the exposure was brief, or if both parties were wearing the appropriate protective equipment, we would simply ask them to continue masking and wearing any other protective equipment that we require based on the business need, and check daily for onset of symptoms. So whether that's a fever, a headache, or any of the symptoms that have been identified for COVID, we would ask them to check for each day and report any onset of symptoms, and of course, cease reporting to work should any symptoms onset. If we determine that the exposure was prolonged or they were not wearing appropriate protective equipment during that interaction with the positive patient, then we would ask them to quarantine for 14 days to ensure there's no onset of symptoms. Should there be an onset of symptoms, we would want them to report that and, of course, be treated through their primary care provider. So certainly you can see it's very easy for an exposure to have a significant impact on your business, but preparing your environment and requiring that appropriate protective equipment for your staff and for your customers can really help decrease and mitigate that risk and scope of exposure.
Great, thanks, Jennifer. And now Angela joins us. Angela, months of remote working and physical distancing are starting to take their toll on some of our employees. Why is it important that we find ways to support teamwork and keep people feeling connected?
Yes, absolutely. Good morning, everyone. Glad that so many folks are joining us once again. That's fantastic. So it's definitely a challenge as we continue to be in what me and my colleagues are calling an intra-COVID world, where kind of this continuation of the pandemic. Certainly teams of all sizes continue to face these challenges. And initially we faced all these challenges without much time for preparation and adjustment. We were really forced, many of us, to move to this work from home model without much ability to plan. There are many businesses who have team members who might be working from home and who are on location by necessity. And of course, each group is going to have their own challenges. One of the challenges for these split teams is the risk of an us versus them mentality, competing either overtly or covertly over who's got it worse, perceiving that the other group is the lucky group, right? So perhaps thinking, oh my gosh, those people working from home, they've got it so easy, just hanging out all day. Whereas the other group might be perceiving, man, those people have it so good, they get to leave their house and actually see people. That would be great. Preventing that kind of divisiveness is going to be really critical to maintaining that team cohesion as we continue to move forward through this pandemic. Next slide. And as these changes have occurred in the way we do our work, so will the dynamics within each of the teams. So I've included this really classic model of team development because I think it's useful to utilize when thinking about how to plan for our team's sort of new development in this new normal. It's important for team leaders to acknowledge these different phases of team development and these different phases that teams are experiencing as a way to sort of normalize all of these changes. We've all really quickly had to figure out this new normal and how to form these new teams, and teams that were perhaps dispersed and now virtual for the first time ever. We're all sort of in this shared forming stage. We kind of trying to figure this out together. We're not sure what this new work situation is going to look like. What's it going to feel like? I know for myself personally, I have been working from home since March. I had to really quickly learn that I needed to designate a space in my house for work to keep me focused, and of course to prevent me from just sort of working round the clock as well. I've got coworkers who've been on location at the hospital who've really had to figure out how to separate themselves safely from their cubicle mates to sort of maintain that safe 6-foot distance. The other phase described here is that storming phase. I mentioned that just a few minutes ago, as well as some of those divisiveness that can happen through that storming phase. Leaders can really help teams through this very common phase by developing what new norms for work groups are like. Virtual meetings with cameras on, perhaps even those virtual quote unquote water cooler times where people have that opportunity to talk with one another. You can also incorporate some really quick team building activities, which I'll talk about in a minute, into your regular meeting agendas. Of course, a big piece that is missing from virtual meetings is that normal sort of chit chat that always occurred in those in-person meetings. That question of, hey, how was your weekend? Do you have upcoming plans? How are the kids, etc. You might consider allowing time for some of that normal chit chat. We all like to socialize. Humans are social creatures, and even in a virtual format, it's nice to have that little bit of human interaction. That can help establish what the new norms are. Next slide. So I think sometimes team building can be thought of as sort of a nicety that maybe you do once a year or twice a year. You have a big team building event, but team building can actually be an ongoing process and has a lot of benefits, particularly as we're all trying to figure out what this new normal looks like for businesses. Can certainly help bring that sense of togetherness with folks, particularly if you've got teams that are dispersed, both remote and then on location. It can actually help foster resiliency, which is certainly something that we could all utilize during this extremely stressful time. Team building can help employee retention. You know, one of the biggest costs to employers is turnover of staff. So really retaining good employees is of the utmost importance. And of course, we want to make sure that our employees are really well engaged. These are really challenging times. Bringing them together as a cohesive group can help with that engagement. Next slide. So I mentioned that I have been working remotely since March, since sort of the beginning of the pandemic here in Maine, and have really gotten accustomed to using video conferencing. So what I would encourage folks to do is utilize your video conferencing and encourage your employees to have their videos on if they're remote. It's much more engaging than simple audio conferencing. You can also read body language. You can sort of see if people aren't paying attention, they're on their phones. So you get a little bit more of that in-person feel. Video conferencing, I have found, and this information from Forbes also tells us this, is that it can actually be almost as good as being in person in 3D. It really does allow for robust communication where you can sort of see body language, you can see facial expressions, you can see if people are paying attention. This also serves to really keep teams that maybe are on location and then also remote connected. So if I can see my colleagues, even if they're not in the same room with me, I feel a bit more connected to them. I myself have found that video conferencing is actually really efficient. They make for meetings where you can actually accomplish work during the context of the meeting, where you don't have to have the meeting, take the work back, and come back. So video conferencing is really effective in that. Next slide. So this was about virtual team building, and I wanted to give you all 3 really concrete examples of how you might incorporate a real quick team building activity in the beginning of any meeting that you have with your staff. The grab and share. I've got some trinkets on my desk. I've got a little Wonder Woman figurine. So that might be something I grabbed and shared one descriptive noun, descriptive word, feeling word about. The Zoom appreciation square. So if you're using WebEx, you could call it WebEx, where you might share something positive in the coworker to the left of their square. Dr. Gilkey's to the left in my square. So I might share something positive about Dr. Gilkey, that he's been running these Zoom sessions really effectively and has been able to really think on his toes. So something like that, simple. And then asking folks, lastly, kind of the 3 words as the team building. So just asking each team member to say 3 words only on how their week is going. You know, and it might be tiring, it could be invigorating, and it could be busy, right? And then move on. So just really kind of a quick connection. And as always, we've got time for questions at the end of the presentation, so I'm happy to also take questions from folks.
Well, thanks, Angela, and thanks for making my day.
You're welcome.
So Andy poses a question for our participants in the chat room. He asks, have you had an employee or customer test positive to COVID-19? If so, how did you respond? We'd love to hear from all of you what your experience is, and feel free to type your response in the chat room. So next up is Dr. Jarvis. Every day we learn something new about this virus. With the frequent changes, it makes it extra challenging to implement requirements to keep our employees and customers safe. Why is it important to operationalize the return to work guidelines, Jim?
It's incredibly important. Trying to be prepared for what's going to come in as you start to bring your employers back, and when you start to bring back your customers and clients. So having that preparedness, and we find that preparedness in healthcare, and particularly in emergency preparedness, is a key to making things go much more smoothly than they would if you just kind of do things on the fly. I'm going to start off quickly just by giving a little update on testing. There was a new partnership announced between the state of Maine and several private businesses, including Northern Light Health, to assist in expanding the testing capabilities for our citizens and visitors to the state of Maine. I will point out that this will be not a rapid process. There's a lot of steps that need to go into place, not the least of which is to deal with that supply chain issue that we've talked about multiple times during these calls. That continues to be an issue for us. You can start to see that around the country as the number of cases are exploding in certain areas, that just challenges our supply chain, particularly the supply chain for testing, even more. Today, the state of California announced that they will be rolling back their testing capabilities to go back to testing only those Tier 1 and Tier 2 individuals that we talked about oh so long ago, back in February, March, and April. We're hopeful that here in Maine, because our positivity rate remains low, that we will continue to be able to test more individuals than just those smaller class. But it all is going to depend on our resources as a country and a nation. Centers for Medicare and Medicaid today released information that they will be sending out testing analyzers, meaning the machines that actually run tests, to long-term care facilities across the country in order to facilitate getting testing of residents and staff at those facilities. There are a lot of questions about that and what particular tests machines they will be rolling out, and so more to come on that. But now we'll talk a little bit about the history of the virus and what we know now that we didn't know when we started talking about this back in February and March. Unfortunately, the list of people that are at higher risk for this illness has grown. Initially, we talked about this just being a disease of people who are older, people with heart disease, people with diabetes, people with cancer, and other long-term chronic illnesses. We've now said that probably it is not just 65 and older. It may be 50 and older that are at higher risk. In addition to that, we added people who are obese to the list. And now we're seeing that the disease is seeming to affect younger people more than it had before. And in fact, as we look at some of these hospitalizations around the country, while people aren't as sick as they were initially coming in, younger people are still requiring hospitalizations because they are requiring high amounts of oxygen that just can't be provided at home. We're also learning that this virus acts differently and produces more symptoms than we ever would have expected from a respiratory-borne virus. Respiratory-borne viruses like influenza and other coronaviruses typically cause pneumonia and just respiratory symptoms. Now, those symptoms can be severe and can certainly lead to catastrophic results. But this virus is acting very differently and in fact causing problems with multiple organ systems within our bodies. The most glaring one being that it affects our blood vessels and causes blood clots to occur, the kind of things that cause things like heart attack, stroke, and other organ system failure. And so that's very concerning and something that we've never seen before. So as we learn more about this virus, we learn more and more that it's acting very differently than anything we've seen before. One of the good news that we found in research is that getting infected from surfaces is not as likely as we originally feared. If you remember, we originally started talking about not only was it important for you to wash your hands and practice good cough and sneeze etiquette, but you need to wash every surface that you came in close contact with. And that led to fears of, is it okay for me to have home delivery of goods and foods and things like that? And do I need to wash down every single surface? And the answer to that is no. It is unlikely for you to contract the virus from surfaces that are not used routinely by other people. So we still recommend that you wash down that shared telephone, that shared keyboard, and make sure that you do good hand hygiene after doing things like opening a door that multiple people utilize. But it's highly unlikely that packages delivered to your business or your home would cause the spread of the disease. So that's some good news. Some unfortunate news is that there's growing evidence that this virus might be spread more readily through aerosols that linger in the air. And we've talked a lot about this being a respiratory virus. So what's the difference between a respiratory virus and an aerosolized virus or an airborne virus? And it really has to do with the size of those droplets that come out of our mouth and nose when we talk, sneeze, cough, sing, yell. For influenza viruses, those droplets need to be fairly large, and that's why we talk about cough and sneeze etiquette for influenza. Initially, we just felt that that was the way this was transmission from this virus as well. Unfortunately, we found that it could also be transmitted through smaller droplets like those that happen when we cough and sing rather than those when we sneeze when we talk and sing rather than those when we cough and sneeze. But there is some evidence that even smaller droplets than normal moisture that comes out during normal breathing may contain enough viral elements for spread of the disease. More to come on that, and right now I don't think it should change any of the health things that we've been talking about. And then we found that people have been seeing longer-term problems after getting infected with the virus that causes COVID-19. These longer health issues may be that it just takes them a long time to recover after the initial infection, or they may be having other issues with other more chronic results from this virus. And so it's very serious and we need to take that serious. So one of the best ways for us to protect ourselves is to continue to do that physical or social distancing and then to practice good face coverings as well. Face coverings are an adjunct to physical and social distancing. I consider them the comparison is physical distancing is like putting your seatbelt on when you get in the car, and face coverings are like the airbag that you have. Each individually help to protect us from trauma during accidents, but added together, they become even more so of a protective fashion. And looking at it, the seatbelt protects you far more than the airbag, and so it's important that we do that physical or social distancing, and then we add to that the face covering. Face coverings do offer some security to the person wearing the mask, but the intent was really to protect others. However, good news again today, there are some studies showing out there that it probably has more protective effects for people wearing the mask, in addition to the fact that when we wear the mask, we protect other people around us in case we have the virus and are asymptomatic. It has been shown over and over again that facial coverings slow transmission of this disease and therefore limit the amount of virus out there in our communities and therefore help protect all of us. As you can see by that graphic, that the best protection we have is when we all wear facial coverings and we all maintain good social distance. And the worst thing that can happen is when we don't practice that at all, that if we come in contact with somebody who's asymptomatic but still infected with the virus, it is highly contagious and spreads readily. So how do we make it face coverings more easily and more palatable for us to wear? We hear constantly of people say, I just feel uncomfortable with these things on my face. It's hot, it's bothersome, it's troublesome for me to breathe. So here's a couple of things that you can try and you can talk about with your employees, and you can also talk about with your customers and clients as well. First of all, there's lots of different kinds of face coverings. There's one that looks more like a traditional mask. There's ones that look more like that neck gaiter that you see many of our workers out in the field use, that bikers and runners might use to help prevent breathing in the dust as they run and bike along our roads. And then there's just simple scarves. So there's lots of different things to try. Face mask type styles come in very different sizes. And so you may find that a smaller one fits better for you. You may find that a larger one does. The key is to remember that it needs to cover both your mouth and your nose. That is the important thing, and Jennifer described that very well. It does not do any effective thing to have it just cover your mouth when you breathe in and out of your nose, because the same moisture or droplets can come out of your nose. I tell people to practice wearing them at home if they feel that it's uncomfortable. If the only time you wear one is that short period of time when you run to the grocery store and get back, it may just be that it feels unusual to you. So wear it at home for a little while to try to feel more comfortable. Those of us in healthcare, we're used to wearing face coverings because we wear masks in many of our settings, obviously in our operating rooms, but many times when we're doing patient care, we need to wear face masks. And so for us, it becomes second nature. But for someone who's never worn one before, it does feel a little bit confining. And so practice can make that feel a little bit better. Some people find that it makes it feel more comfortable if they take a few deep breaths prior to placing their face mask on. That alleviates that feeling that somehow air is being blocked when you put your face covering on. But no face mask or cloth face covering will prevent air exchange from happening. So you'll be getting plenty of oxygen during this, and you'll be able to exhale and get out your CO2. So really, they do not impede breathing. And then schedule mask breaks. So if you're in an office setting, particularly in one of those cubicle settings where you're going to have to wear your face covering throughout most of the day, schedule some time where you can take that face covering off. We highly recommend that you do this outside, and you must do this when you can maintain good social distancing of at least 6 feet away from other people. But if you do that a couple of times a day, again, makes it feel more palatable to wear our face coverings. Next slide. So how do we respond to questions about face coverings? And I'm happy that Walmart and Sam's Club decided yesterday that they will now require these for all customers entering into their businesses. And we expect that we will see more businesses, particularly those large box chains, follow suit, as Walmart being one of our largest employers and largest retailers. But how do you respond to these questions with your staff or with your clients who don't want to wear one? Some of the challenges we hear is that people say face coverings lower our immunity. That is not true. These are usually from the same people who talk about the same things for vaccines, that being vaccinated in some way prevents us from getting exposed to things that are out in the community that help our own natural immunity. That's not really what happens. And we know there are many diseases out there that we would never want to expose ourselves to, and COVID-19 is one of them. Face coverings do offer some protection for the person who is wearing it, though as I said, it is really to protect other people from us in case we are asymptomatic. But as I said earlier, new data says that face coverings do offer more protection for the wearer, and so I think that should be a little bit more comforting for us. We also know that communities where face coverings are the norm have a lower incidence of community spread. Here in the state of Maine, we have two things going for us. We have our natural geography that has natural social distancing between communities. but we also have had a high number of individuals who very early on decided that they were going to wear face coverings when they were out and about. And guess what? We are one of 2 states in the United States that has a decrease in the number of cases of COVID-19 now. We're doing a good job. I like to remind people, science and diseases are apolitical. Just in the last couple of weeks, we've had very high-profile Republican and Democratic leaders who have come down positive with COVID-19. So it does not know that what political party affiliation you have. It doesn't care about political party affiliations, and neither does science. Science tells us that face coverings are one of the best protective measures for us to stay healthy. Things like hand washing, seatbelt wearing, face coverings save lives, but they also save money. Why? Because they will ultimately result in lower healthcare and health insurance costs. Seatbelts have driven down the price of auto insurance for all of us. Airbags added to that lowering of that cost. For those of us who are business leaders, we have to remember that we often are paying our health insurance premiums on behalf of our employees. If our employees get sick, especially if they get severely ill with COVID-19, your insurance premiums are going to go up. In fact, all of our healthcare costs are going to go up as a result of this pandemic. So anything we can do to limit that spread of disease will actually save us money. And in fact, 2 economic studies came out in the last month that showed that. One more famously was the one that came out of Wall Street that said that anything we can do to curb the spread of this disease will actually save money for all industries in the long run, even though it is causing some economic harm in the short run. Hospitalizations and death have economic impacts. They are extremely costly. There was some people who initially thought, hey, why don't we just let those people who are already at the end of their life catch the disease while the rest of us get along with our lives? Well, guess what? That would cause major problems from finance too, as hospitalization and their funeral costs and expenses will be borne by the rest of us. And with that, I think we'll turn to questions, and I'll turn it back over to Ed.
Okay, well, thanks, Jim. And Jim, we really appreciate all the effort you put in to stay up to date and share that cutting edge information with us, and how so effectively you really keep us informed about this particular coronavirus. So thank you for that on an ongoing basis.
Well, I thank Northern Light Health for giving me the opportunity to do so. We are very fortunate that that my employer gives me the time to keep up to date, so I can keep all the rest of our employers healthy.
That's great. So I'll share with our participants today. Angela told you that she's been working remotely since March, and for quite a while, I too were working remotely. In the beginning of July, we transitioned in my division over to a hybrid model for our leadership team, and that means several days per week I'm in the office and several days per week at home. And it's interesting adjusting to that and what you can accomplish. And we're in the process of learning what's the most effective meeting strategy, considering who's present in person and who's present through Zoom. So we're adjusting to all of that. So now let's focus on the questions. I will group the similar questions together so that we can address as many questions as possible. The first 2 questions actually today is for Jennifer, and they come from Susan, who asks, do employers wait and find out the answers to the exposure questions only after you learn of a positive test result? And the follow-up question is, does the employer need to do anything while waiting for the results of an employee who needed to be tested? Jennifer?
Great question. So certainly the less time that goes by once you have an employee or customer who identifies that they have symptoms, to start asking those questions as far as who was in contact, what were they wearing for protective equipment, and otherwise, the better. We have a better recollection of who we interacted with and what we might have been wearing at that time. So certainly helpful to start gathering that information once you know an employee or customer is being tested or at least has symptoms. Nothing to do as far as asking folks to quarantine or self-monitor until you do have that confirmation of a positive test result.
Great, thank you. The next question is for Dr. Jarvis, and it comes from Edie, and actually it's two questions, and it's really probing the data reporting. When we hear the CDC reports of the people who have recovered in Maine, how is that determined? What if people are having long-term effects such as you stated? Are they included in the recovery category even though they are still suffering from lingering effects?
That's a really good question. I don't have the specifics on it, but I can tell you what happens now. So all test reports, particularly those that are positive, are reported to the state CDC. And then the state CDC does two things. It does some contact tracing to determine where that exposure has been and who may have been exposed so that they can offer assistance in those particular areas. But it also follows up with the individual who had the positive case and then follows them over time. So they're determined to be recovered when they no longer need to utilize the healthcare system for whatever their disease entity is, or if they didn't need to use healthcare at all because they just had mild symptoms when their symptoms have completely recovered. And so that's how they determine that. It's the reason why when you look at that number, there's been that constant number of individuals who have not recovered. Some of those have been our patients that have been long-term inpatients within our healthcare facilities, and some of them are the people that you mentioned who have long-term effects but don't require hospitalization. So yes, they do take into account all of those factors when they talk about who has recovered. Basically, those who have recovered have become symptom-free and no longer have any long-term effects.
Thanks, Jim. I'll also comment on data and how it's reported. So it's important to understand when we see coming out of the Maine CDC, the confirmed cases. Those are confirmed cases for Maine residents. And those Maine residents perhaps are in Maine, like most would be expected, but they're also located in other states. For instance, if somebody is actually staying in Florida, you know, extending their normal winter stay and they're staying in Florida, if they test positive in Florida, that will be a Maine confirmed case. The flip side of that, of course, has me concerned in terms of data. What it doesn't tell us are those folks from out of state who test positive while in Maine. Those numbers are reported as confirmed cases in their state of residence. So we don't really understand right now what the volume of out-of-state people who test positive are. So that's one qualifier of the data that we have. The one good thing about that is all 50 states, through their CDCs, report the data the same way. So the roll-up data is very, very effective for us to understand. Okay, so the next question is for Angela. Angela, many people respond to, "How are you?" with, "I'm fine." None of us is fine. Let's just put that out on the table. When do you dig deeper, and how do you do that?
Yeah, that's a great question, and I'm glad that you put that on the table, right? None of us are fine. That is true. This is wildly stressful for everyone, both at work and in everyone's personal lives on so many levels. So one of the things that I tell leaders to do is when they're checking in with their staff, is that they actually just turn that question on its head ever so slightly by, rather than saying, "How are you doing? How are things going?" Because the response, of course, is fine. You just, a little tweak to the language by saying, "What are you feeling?" It's a tiny little tweak. And then the way to get people to actually tell you how they're feeling is for you to model that yourself. So if I were to do that, I might say, you know, "Hey, Dr. Gilkey, what are you feeling today? I'm feeling pretty overwhelmed. I feel like I've got a lot on my plate." And then that can kind of give you an opportunity to actually say something other than fine and be a little bit more honest with how you're feeling.
Great, thank you. I'll follow up that with a comment. One of the favorite quotes that our CEO, Tim Dentry, puts out for all of us to consider, particularly as we're working through quality improvement processes, is from Maya Angelou. And off the top of my head, I will share that with you, so I'm paraphrasing perhaps. But she tells us that people will forget what you said. People will forget what you did, but people will never forget how you made them feel. So, you know, if we think about that during these times, perhaps we get to say the right things to people. So anyway, the next question is for Jennifer. Jennifer, getting employees back to work, what is top of mind for you?
It's providing an environment that the employee is going to come back and feel as safe as possible. We understand, you know, to your point, we're not all fine, but creating a safe space for them to be able to express those feelings and concerns and allow them to talk those through, but provide the security of the universal masking and protective equipment and sanitizing, and putting those things into place so they feel as comfortable as possible coming back to the environment.
So making it clear that their safety is, you know, top of mind.
Absolutely.
Great. Well, thanks, Jennifer. The next question is for Angela. Angela, all the decisions management makes for return to work are compromises. How can we address team groupthink that is negative? Because we do find that employees second-guess management decisions. So regarding that return to work decision specifically, so, you know, we all could do better than what the manager can do.
Right, exactly.
Comment on that, please.
That's a really good point, and I think a good question. You know, one of the things that can actually be really helpful, particularly in the context of this novel virus, is the fact that we're all learning as the science and the medicine learns and gets updated. So providing your employees an opportunity to ask some questions, to provide them with a forum where they can express their concerns is actually really critical. And then one of the things I always like to say too is that often when people are expressing sort of negativity or anger, that tends to be a pretty surface emotion. Typically, particularly in this situation, what's underneath that is actually fear. Fear for my job, fear for my safety, fear for my kids, fear for my finances. So if we can sort of get to the heart of that matter for folks and say, you know, I understand this is really a scary time period. We want to keep you safe, as Jennifer just talked about, and we want to keep our businesses open and our doors open so that we can ensure that we're all getting paychecks so that we keep ourselves financially safe. So you kind of talk about things really from that perspective of what's underneath that negativity.
Great, thanks, Angela. One of the things that I consider is that some people, very typically, your thought leaders or opinion leaders or your sort of the quiet leader behind the scenes, very frequently do much better when they understand the context of the directives. So, you know, I encourage everyone to consider that, and that might be a way to have that thought leader brought on board a bit easier. The next question is for Jim. Last week, it was reported that a hospitalized 30-year-old with COVID had gone to a COVID party. Apparently, it's a contemporary way to get infected and somewhat valued, and said to his nurse in the hospital, "I think I made a mistake." He died. Considering the rapid evolution of knowledge you've described, and week in, week out, helping us to understand that evolution, what mistakes do you want to point out for our listeners to avoid?
So that's a key one, is avoiding those situations where you put yourself at risk or put others at risk. And so one of the mistakes that I see most commonly made is that people just assume that their friends and family must be negative of this disease. And so they congregate with them, going to parties or weddings. Hopefully most people are not doing it intentionally like that unfortunate individual did, of intentionally trying to acquire the virus to see what would happen. But we do see that people gather. And remember, many people either never show symptoms while they're infected with the virus and can still spread the virus to others, or are able to spread the virus before they get symptomatic. And so with that, you just don't know people outside your everyday household that you sleep in the same building with. You just don't know where they have been, what they've been doing, or whether or not they've come in contact with someone else who may have been infectious. They get infected and then they spread it to you. So I think that's the most worrisome thing. And we've all seen it. We've driven down the street and seen the celebration for the graduation, the engagement party, just the backyard barbecue. All of those things you need to consider. But there's some other things that I've seen people do mistakes about. One of them is wearing gloves. So the thought is, well, if I wear gloves, I can protect myself from all those touching points that we talk about that need to be cleaned. The issue there is that many people then forget to do good hand hygiene, and they have their gloved hand that's now covered with the virus, and they touch their mouth and their face, and they touch everything else. We would actually rather that you don't wear gloves unless you're in contact with something that requires them, and rather you making sure that you're doing good hand hygiene, washing your hands frequently, and using a good hand sanitizer, particularly after touching a high-touch area. The other mistake is one that I think we've all made, which is we're in our office. We aren't wearing our face covering because we're in a secluded office where we don't have to worry about somebody coming in and out. But then we need to use the restroom, and we get up and we walk down the hallway to the restroom forgetting to put our face covering on. I know I personally have done that a few times. I even had one time where an employee caught me in the hallway, and I'm usually the one that's doing that. That's the one that yelling at everybody else that they need to do it. And so we're all susceptible of that. So it's just going to have to become part of our routine that when we're out in a place where we can meet other individuals, we need to be wearing our face coverings. And then lastly is just that important thing. Again, I can't stress hand hygiene enough. Every time you touch that face covering and every other surface, trying to remember that good hand hygiene, is the best thing we can do.
Thanks, Jim. I realize with this question that we could probably have an entire hour on this question alone. So I'll weigh in on it by saying I spend a lot of time, like Dr. Jarvis does, really trying to understand this particular coronavirus, what it does to people, and what do we need to learn rapidly about it. And I would say I see the overall biggest mistake would be to underestimate the capabilities of this coronavirus. It does its business very well, and that's to infect people. So having said that, the next question is for Jennifer. Some restaurants are requiring contact information of their customers before they allow them to order on site, for the sit-down meals. Do you have comments about that?
It's certainly helpful as we, talk about understanding if a customer or employee tests positive. We want to make sure that we're able to connect with each person that infected individual came in contact with, so that we can provide them with the information and they can choose to self-monitor or quarantine depending on what that interaction was. So it's certainly helpful given that information.
Great, thanks. Angela, are traditional team building exercises still appropriate, or is a different sensitivity and different set of exercises needed today for that team building?
Yeah, that's a really good question. Oftentimes traditional team building exercises, one, asks for people to sort of be physically in the same room. Now, there's a lot of guidelines from the CDC and certainly Dr. Jarvis, yourself, Dr. Gilkey. There's others that can talk about what the CDC guidelines are around that piece. So in terms of that physical presence, and I'm not sure that would necessarily be recommended at this point, but in terms of content, much of that content is actually really still appropriate. Much of team building is about building the group cohesion, encouraging group interaction, figuring out how to work together as a team and a unit, and really building morale so that you feel as if, hey, yeah, I'm part of this team. We can work together. I know that I can count on my colleagues to help me with these projects that I need to get done. So much of those activities are still really valuable. We would just encourage folks to follow the CDC guidelines in regards to anything in person, but much of that you can do virtually as well.
Yeah, and I guess we all recognize that being particularly sensitive to one another, is very appropriate throughout all of this. Thank you. Um, Jim, this next question is for you, and this one is, I think, a particularly valuable question. I think the answers that we could provide really are great takeaway bits of information. And so we went from no masks back in March to wearing masks and facial coverings. And clearly, trust in the guidance has been compromised. People are still saying, well, it used to be no mask, what's changed, right? So are there facts that employers can be armed with to overcome these issues in their businesses? Like, for instance, in March, the federal government said masks were not useful, and there was an extreme shortage of masks, which were needed by the frontline healthcare workers. So, you can't help but think part of the government response at that point was to manage the bigger picture, if you will. Are there other factoids that could be helpful for our employers on the line to really engage people who are resistant?
Yeah, and that's a great question. And I certainly, when I'm doing some media presentations early on, said the exact same thing. And so people have said to me, well, you've changed your mind. And I didn't change my mind. We just learned more. That's the key issue. So initially, the reason why we talked about masks in particular for the general population is because we didn't just make masks. Most masks were used for the healthcare industry, and we knew they were in short supply prior to the pandemic, and then even further short supply after the pandemic started. And so we needed to protect those masks to protect our healthcare workers, our first responders, our military, our police, so that they could be out there doing the job that they need to do to keep us all safe and healthy. And so that was one aspect of things. The other aspect is we just didn't know whether masks or face coverings, for that matter, provided any sense of protection initially. And so asking people to do something without science behind it was just wrong. Now we have evidence. Now we've done data collection, and now we realize that this particular virus, that wearing face coverings does decrease that amount of virus out in our community, and therefore decreases community spread and decreases the number of individuals infected. And that now is science that's irrefutable. And in fact, it's been enhanced with more recent data saying that not only do face coverings protect individuals from the person wearing the mask, but also protect the mask wearer as well from other individuals. And so data has changed, science has caught up with that data, and so that's the facts on the ground as we see it today. Will things change? Probably. Maybe we'll recommend a particular kind of cloth that the mask needs to be made out of, but right now we don't have that. But we do know that any kind of physical barrier between you and another person helps prevent the spread of the disease, and that's the message we all should be stating now.
Yeah, I think it reinforces there's an awful lot of either misinformation or information that's out there that seems like it's easily interpretable depending on what your view in the world is. And I think what we can do is help our employees work through that to make some logical sense of why the recommendations are the way they are. I think our final question today comes from Diane. And Jennifer, why don't you take a shot at this? So it is a bad idea to have a company barbecue outside in the summer with 6 feet distancing and only one caterer handling all the food. Group might be 20 to 30 in a large parking lot. How would you comment on that?
So that's a good question, and I think something that a lot of us are talking about right now because it's that time of year. The 6 foot distancing, if you think of an average picnic table, that's 2 people at a picnic table on opposite sides in opposite corners of that picnic table to provide that 6 foot distance while they're unmasked and eating. So it's really important to consider that as you're looking at potentially planning something. And then also making sure that the attendees are only unmasked while they're eating. I think similar to what Dr. Jarvis shared, we sit in an office with the door closed and we don't think about it when we walk out. And so it's very easy to do the same thing. We're eating and we finish our meal and forget to put it back on. So making sure that folks in attendance would be complying with that component of it as well would be something to consider.
Great, thanks, Jennifer. I'll take the liberty of commenting too, Diane. I see things from a mathematical viewpoint, a probability, if you will. So if we think about staying home with no outside contact at all, our probability of getting the coronavirus is 0. You know, it doesn't flow through the air and get into our ventilation systems in our home. Every decision we make beyond that can increase the probability of infection. So we've talked a lot about the low prevalence of disease, at least in most of Maine. You know, Cumberland County might be somewhat the exception, where the prevalence of the disease is low. So we can get away with a lot, perhaps, until we don't. And we understand what that means and how quickly a hotspot can develop, whether in our state or what we've seen in other states. So each decision we make increases that probability of exposure to the virus. And I've already said today, the virus does one thing well: it infects people. Every single opportunity it gets, it will be successful. So I think that's the best way to approach your question, in an educated mindset of what kind of risk is involved in the decisions that you're making. 20 to 30, 100, keeping more than 6 feet between people, all of that makes a difference. So here we are at the top of our hour. So thank you to our panelists. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information and insights to collectively and safely reopen Maine. We hope you have found the last hour a good use of your time and you were able to identify some useful tips to apply to your business. Next week, our Zoom conference is going to have a different format. We will be utilizing a roundtable discussion format with experts from across Northern Light Health. We encourage you to share your questions ahead of time when you register, or you can send them to Lainey Abbott, and her contact information is up on your screen. We will incorporate your questions into next week's discussion. We will look forward to meeting with you next Thursday at 11. We will send you the link along with the topics for week 7. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will help Maine safely open back up for business. Thank you and have a good afternoon.